Hi, my name is Anna Rogers, and this is my Week 1 discussion to post. As nurses, we strive to give the highest quality care. But what if that's just not possible? What if the cards are stacked against us? Medical errors are real, and medical errors happen every day, simply because we are human, and human error is real. In the documentary Chasing Zero, Winning the War on Healthcare Harm, produced by TMIT in April of 2010, showed many examples of this healthcare harm. Chasing Zero also described a lack of denial by healthcare organizations, simply from a fear of shame, malpractice lawsuits, and even the cost that results from medical errors. But these reasons are simply not enough to stay quiet. Patients need our voices and need advocacy. It was truly heartbreaking to listen to parents share stories about losing their child, especially when those deaths could have been 100% preventable. In the healthcare organization that I work at currently, I am a pediatric oncology nurse, and on one of the days of treatment, our children go down to IR for a LP, and during the LP, they receive chemo intrathecally, and then they come back up to the floor, and then right away they get another medication called vincristine. In old practice, that was just IV push over 3-5 minutes, and then we would move on to the next bag of chemo to be hung. But after deaths at other institutions, and accidents happening from the vincristine being sent to the OR with the patient and then it being pushed intrathecally instead of a different chemo, the vincristine resulted in immediate death by patients. So we have changed our practice at Children's Wisconsin to only having vincristine in secondary bags. This was a change in workflow and does take more time due to the bigger volume, but has prevented 100% of fatal deaths by vincristine being pushed intrathecally into an LP procedure. So, as nurses, we need to speak up. We need to be a voice. We need to exercise our ability to be advocates for the best and safest care for our patients. We need to be willing to admit mistakes and take ownership. Together, we can come alongside of each other, we can learn, we can grow, and we can increase the quality of care that we give.